Bismillahirrahmanirrahim. Today I'll be presenting critical appraisal of a study that is already being shared with you all under kind supervision of Dr. Saira Afzal. Quote of the day: if Allah can turn night into day, then surely Allah can turn the darkness of your life into happiness and prosperity. Trust in Allah. Today I'll be using strobe checklist for the critical appraisal of the article. Here is the strobe checklist. So final criteria I'll be also using final criteria for the title. Here's the title: Prevalence and Demographics, Socioeconomic and Behavioral Risk Factors of Self-Reported Symptoms of Sexually Transmitted Infections Among Ever Married Women. Evidence from Nationally Representative Surveys in Bangladesh. Abstract: STI symptoms, for example, abnormal genital discharge and genital sores, are major public health concerns in Bangladesh. This study investigates the prevalence of STI symptoms among ever married women in Bangladesh and association of STI symptoms with various socioeconomic, demographic, and behavioral factors. Using the most recent data 2007, 11, and 2014 of the Bangladesh Demographic and Health Surveys. The BDHS employs a two-stage stratified sampling technique. The study found that the prevalence of abnormal genital discharge and genital sores among ever married women aged 15 to 49 years was 10% and 6%. Findings have implications for interventions efforts aiming to improve women's sexual and reproductive health in Bangladesh. Introduction. Here in this paragraph, they have given the scientific background. STI symptoms, for example, gonorrhea, chlamydia, syphilis, and trichomoniasis generally transmitted through sexual contact. The prevalence of STI is increasing. The increasing STI burdens remain a major public health concerns in Bangladesh, especially among women. Rationale. The current study provides a scientific understanding of the self-reported STI symptoms and the demographic, socioeconomic, and behavioral factors of STI symptoms, which are crucial to inform public health interventions in Bangladesh. Materials and methods. Here, the data source and sample is given. The study used 3 most recent rounds of the Bangladesh Demographic and Health Surveys. Study participants were ever married women of reproductive age from Bangladesh. 15 to 49 years with the age. Outcome variables: self-reported STI symptoms such as abnormal genital discharge, genital sores, ulcers. Explanatory variables are categorized into these 3: demographic, socioeconomic, and behavioral factors. Further, these are the factors which are variables which are given. This is age at first marriage, type of residence, socioeconomic, partners, education, wealth quantile, paid work status, behavioral factors, contraceptive methods, knowledge about STI, wife beating, justified women's healthcare decision-making, exposure to mass media, and surveyor. Materials and methods. Statistical analysis was based on a pooled sample of 3 rounds of BDHS. A sample size was 41,777 ever married women aged 15 to 49 years. The significance of difference was assessed with Pearson's chi-square test. We evaluated the association of STI outcomes with demographic, socioeconomic, and behavioral risk factors using 3 separate logistic regression models containing variables with a p-value below 0.20 from the earlier set of chi-square tests. A sensitive analysis with an impure data set was done, assessing the possible influence of missing data. So here is the list of the explanatory variables, which are demographic, socioeconomic, and behavioral. They are further categorized into the, these are the categories. So basically, these were the qualitative variables. So here they are. Results. In this whole paragraph, they have summarized the result outcomes. More than 1/3 of the participants aged 25 to 34 years had abnormal genital discharge. About 40% had their first marriage when they were 9 to 14 years old. 3 out of 4 were in rural areas. Approximately 26% had no education. And 1/5 of the women with STI symptoms were from the richest wealth quintile. 79% had no paid work. 92% responded that beating by a husband was not justified. 35% of women had no exposure to mass media. Prevalence of STI symptoms by key risk factors. The STI symptoms were more prevalent among women aged 25 to 34 years, first married at 9 to 14 years, lived in rural areas, had primary level education, and from poorer households. In addition, women who use traditional and modern contraceptive methods, the prevalence was also seen in these. Association of STI symptoms with demographic, socioeconomic, and behavioral risk factors presents the adjusted odd ratios with a 95% confidence interval. So in this diagram, you can see the prevalence of STI symptoms among ever married women aged 15 to 49 years in Bangladesh. So in this diagram, they have summarized all the prevalence of the different STI symptoms of the different variables. So the more prevalent being the age 24, 25, the mean age is 25 to 34 years, and the age at first marriage is 9 to 14 years. And those with the using those who use the traditional method of contraception, the prevalence was also seen in them, and those who had no education, so the prevalence was also seen in them. So discussions in this whole paragraph, they have summarized the basic the basic outcomes, and the study examined the association of demographic, socioeconomic, and behavioral risk factors. So the age as a key demographic risk factor. Strengths and limitations are being they themselves have described the strength and limitation. The key strength used is that they use most recent rounds of BDHS data, and they have further therefore the findings are generalizable to the woman of reproductive age. So they have discussed three type of bias, which are the recall bias and the non-disclosure bias and the desirability bias. So because of the self-reported STI symptoms, but they have not completely addressed that how they have properly handled the bias. So here are the limitations which are being discussed. The STI symptoms were self-reported. There was no clinical diagnosis, overestimation of outcome of interest. They couldn't establish the causal mechanism. And these limitations highlight the need for further research. The source of funding is being mentioned here. Informed consent was taken in the form of written informed consent, and conflict of interest, there was no conflict of interest. Now, critical appraisal using the STOP checklist, title and abstract. Indicate the study design with a commonly used term in the title or the abstract. Yes, title is concise and clear. It does mention the study design. Abstract does not mention the study design. Provide in the abstract an informative and balanced summary of what was done and what was found. Yes, abstract is informative and provides a balanced summary of what was done and what was found. It is unstructured. Introduction, background, and rationale. Explain the scientific background and rationale for the investigation being reported. Yes, the scientific background is explained, and the rationale for the investigation is being reported, but the rationale is weak because they have included the self-reported STI symptoms. There is no clinical diagnosis being included here. Objective, state specific objectives, including any per specified hypothesis. So objective is not mentioned. Methods, a study design presents key elements of study design early in the paper. Yes, mentioned the BDHS is a nationally representative cross-sectional household survey conducted every 3 years. Setting, describe the setting, location, and relevant dates, including periods of recruitment, exposure, follow-up, and data collection. Yes, it's mentioned as it is a secondary analysis, and they have gathered the secondary data. So this study used the data from three most recent rounds, 2007, 11, and 14 of the Bangladesh Demographic and Health Service BDHS. And the BDHS applied a two-stage certified sampling technique to collect data on various demographic, socioeconomic, and behavioral risk factors and STI symptoms from ever married women. Methods, participants gives the eligibility criteria and the sources and methods of selection of participants. It does give the eligibility criteria. Inclusion criteria is given, which is study participants were ever married women of reproductive age 15 to 49 years from Bangladesh. No exclusion criteria is given. It does not mention the sources and methods of selection of participants. Variables, clearly define all the outcomes, exposures, predictors, potential confounders, and effect modifiers. Give diagnostic criteria if applicable. Yes, it's mentioned. They have explained the outcome variables and explanatory variables, which are basically the qualitative variables. They have defined them. No diagnostic criteria is given. Data, sources, and measurements. For each variable of interest, give sources of data and details of methods of assessment. It does mention the data sources. Generalized secondary data is used, no data collected individually. Methods, bias. Describe any efforts to address potential sources of bias. No, it's not mentioned. Study size, explain how the study size was arrived at. No, they have not mentioned how they calculated the study size, but the sample size is mentioned, which is 41,777. Quantity variables, explain how quantity variables were handled in the analysis. If applicable, describe which groupings were chosen and why. It's mentioned here, they have converted the quantity variable, which was age, into qualitative categorical variable by making the subgroups. Methods, statistical methods, describe all the statistical methods, including those used to control for confounding. Yes, it does describe the statistical methods. Describe any methods used to examine subgroups and interactions. Yes, they have mentioned it. The significance of difference was assessed with Pearson's chi-square test. Association of STI outcomes with demographic, socioeconomic, and behavioral respectors was assessed using 3 separate logistic regression models containing variables with a p-value below 0.20 from the earlier set of chi-square tests. C. Missing data were addressed. Yes, missing data is mentioned, but they have not clearly addressed how they have handled it. Describe any sensitivity analysis. Yes, it's mentioned a sensitivity analysis with an imputed dataset assess the possible influence of missing data on the calculated coefficients. Results. Participants report number of individuals each stage of study, for example, number potentially eligible, examined for eligible data, eligibility, confirmed eligible, included in the study, completing follow-up and analyzed. No, it's not applicable here because it's secondary analysis and they have used the generalized secondary data. B, give reasons for non-participants at each stage. No, it's not mentioned here. C, consider use of flow diagram. No, they have not used any flow diagram. Outcome data, report a number of outcome events or summary measures. Yes, it's mentioned here. Discussion. Key results. Summarize key results with reference to study objectives. Yes, it does summarize the key results. Limitations. Discuss limitations of the study taking no into account sources of potential bias or imprecision. Discuss both direction and magnitude of any potential bias. Yes, it's mentioned they themselves have explained the limitations. STI symptoms, basically 5 limitations are being given in this article. They have STI symptoms were self-reported, and the STI symptoms in women's demographic, socioeconomic, and behavioral characteristics were self-reported, often subject to recall bias, non-disclosure bias. Self-reporting has possibly resulted in social desirability bias, but they have not clearly mentioned how they have handled them. Although these are there are many STI symptoms, they have only used 2 symptoms. They have only considered 2 symptoms. So, symptom including abnormal genital discharge and dental sores and ulcers. Overestimation of outcomes of interest. The extent of abnormal genital discharge and genital sores of the participants is not known. We cannot establish the causal mechanisms through which the risk factors influence STI and self-reported symptoms. Interpretation. Give a cautious overall interpretation of results considering objectives, limitations, multiplicity of analysis, results from similar studies, and other relevant evidence. Yes, they gave a cautious overall interpretations of results considering multiplicity of analysis, results from similar studies, and other relevant evidence, limitations mentioned. Discussion. Generalizability. Discuss the generalizability, external validity of the study results. Yes, they have discussed it. The study used the 3 most recent rounds of the BDHS data is representative of the general population. Therefore, the findings are generalizable to the women of reproductive age in Bangladesh in similar settings. Other information, funding. Give the source of funding and the role of the funders for the present study, if applicable, for the original study on which the present article is based. Yes, they have mentioned it. They have talked about the source of funding in the article. Summarization of the key points of critical appraisal. Strengths. Scientific background is mentioned, setting mentioned, source of second data given, explained variables and associations, good statistical analysis interpretation, sensitive analysis done to control confounders, strength and limitations explained. Limitations. No objective mentioned, weak rationale, self-reported STI symptoms are reported, no clinical diagnosis addressed, no bias being addressed properly, only sample size given, how they calculated and how many people reported positive not mentioned, overestimation of outcome of interest, which is a sample, is the limitation here. Generalized secondary data used, no data was collected individually, and also they have not considered use of any flow diagrams. Thank you so much. Here's the link of the YouTube channel. Kindly like and subscribe.
Thank you very much, Dr. Amna. Very nice presentation, very informative. And I am really pleased at how you have presented today and the improvement that has been seen. That is tremendous. Would